And I want to also thank Ranking Member Buzz for his work on this. And I want to thank the committee for its work on the VA Mission Telehealth Clarification Act that passed last Congress. With this passage as part of the NDAA, trainees working at VA at the Veteran Affairs Centers can now participate in an important telehealth program serving our veterans. It's critically important that our veterans are able to access care no matter where they are. And I'm pleased that this remains a priority for the committee. That said, the VA's community care program continues to be an issue for the veterans in Georgia's 1st Congressional District that I have the honor and privilege of representing. Our district does not have a VA medical center, which means in order to receive any emergency care or specialty procedures, they need to travel, sometimes great distances. Like many other districts, we only have outpatient clinics and lean on the ability for veterans to receive care in the community. However, the number one complaint I receive is that a veteran is unable to see a provider locally and must travel hours away to a VA medical center. I urge the committee to continue improving the community care program to be convenient and effective for our veterans and our providers. Next, I would like to highlight the need for improved mental health services for veterans. Our men and women in uniform have some of the most rigorous and difficult jobs that exist. They deploy to every corner of the globe and brave combat in order to protect our freedoms. Just as we care for the physical wounds for him who shall have borne the battle, we must care for the mental health of our veterans. Mental health issues among veterans can disproportionately lead to drug abuse, homelessness, and suicide. One veteran suicide or one homeless veteran is one too many. And we must end this tragic statistic that as many as 20 veterans die by suicide every day. Further, the isolation and anxiety of COVID-19 has added even more stress for our veterans, exacerbating an already significant mental health challenge. In fact, VA facilities around the country have reported dramatic increases in virtual mental health services during the pandemic. The committee must ensure that the VA is equipped to address the increased demand for mental health services. Lastly, although the National Personnel Record Center does not fall under the Department of Veteran Affairs, I would like to emphasize the need to clear the backlog of record requests. While the NPRC has returned to a pre-pandemic level of operations, there remains a significant backlog of approximately 500,000 requests. These records are necessary to complete veterans' claims for compensation care and other benefits. Without them, a veteran is stuck waiting for the NPRC to clear its backlog before he or she can complete their claim. Please do everything within the committee's power to ensure our veterans are not deprived of their essential care. Thank you again for providing this opportunity to share the priorities and concerns of veterans in my district. I look forward to working with the committee to provide the best care and benefits possible to our veterans. Thank you again, Madam Chair, Ranking Member Bose, and I yield back.
Thank you, Congressman.